All right, it's currently 1 p.m. here in our Scottsdale, Arizona location, and it's time to get started. Just so everyone knows, we will be doing a full Q&A session at the end of the presentation. You can submit your questions in the chat window at any time during the presentation, and we'll gather them all and answer as many as we can right at the end. If we do not get to all the questions, we will follow up with you directly via email to make sure your questions do get answered. We'll also be making this presentation available to everyone who's registered for the webinar. A link will be provided in our follow-up email within a few days of this presentation. And with that, I think we can begin. If you have not heard, your presentation today is from Dr. Jaquel Patterson. Dr. Jaquel Patterson is a nationally recognized naturopathic physician and functional medicine expert with over 11 years of clinical experience. Her focus is on autoimmune conditions, joint pain, Lyme disease, and allergies. She's an integrative practice success builder and an expert, and also the president of the American Association for Naturopathic Physicians. So give me one moment and we'll go ahead and get started.
Hi, everybody. So excited to talk today. My name is Dr. Jaquel Patterson, naturopathic physician, and today I will be talking on breakthrough in stem cell activation, the first oral protein complex for tissue regeneration. So I'm going to just share my screen quickly here, and we'll begin. Okay, so as I said, my name is Dr. Jaquel Patterson. I am a naturopathic physician. I've been practicing for over 11 years, and my focus in clinical practice is autoimmune conditions, joint pain, Lyme disease. Over half of my patients have Lyme disease and joint-related pain, and then also allergies. I also help to work with integrative providers in having successful businesses and thriving both in their business and personally. And I am currently the president for the American Association of Naturopathic Physicians, as well as the on the board for the Connecticut Association for Naturopathic Physicians. So some key objectives for our discussion today will include an overall introduction to the principles of osteoinduction. Then we are going to go through the epidemiology and pathology. And then we will go through the osteoinductive protein complex and the inflammatory modulating effects of BMPs, also known, the full name is bone morphogenic proteins, the BMPs and their stem signaling process, as well as the principles of bone and cartilage regeneration. And then we will go through literature review and clinical trials. So the patent for this name of this nature's BMP complex, the name is called cyplexinol, and it's the first all-natural ingredient proven to do two things, two activities. So one is to activate the stem cells, and the second is to regenerate tissue. So it's a natural bioactive protein complex. It contains the bone morphogenic proteins, BMPs, as well as containing growth factors like TGF beta, helping to increase angiogenesis, IGF, insulin growth factor, VEGF, and BFGF. So I'm now going to go through the pathophysiology and epidemiology of osteoporosis. It does have a complex etiology. It's multifactorial. There are some genetic determinants. And it also is can also be connected based on hormonal factors, environment, as well as nutrition. So 54 million Americans are affected by osteoporosis and also low bone mass in terms of osteopenia. And more than half of all of US adults are currently affected. So meaning half the patients that come into your office that you serve will have be impacted somehow with osteoporosis. It does accumulate to 2 million fractures annually to osteoporosis, and the majority of these are hip fractures, which can account for about 72% of healthcare costs. And there is an estimate by 2025, the costs are expected to be close to 25.3 billion. That's a lot, 25.3 billion in healthcare costs. So osteoarthritis, in terms of the pathophysiology and epidemiology, one in two may develop symptomatic knee osteoarthritis by age 85 years old. However, most people are going to be getting symptoms of osteoarthritis in terms of joint pain and stiffness, typically in their 40s and 50s. And the most common triggers or the causes for these triggers are one, tissue damage from mechanical injury. So for an individual, for example, that had a torn meniscus. Also the transmission of inflammatory mediators from the synovium into the cartilage. And then thirdly, the defects in cartilage metabolism. So what they find was that BMP4 and BMP5 are reduced in individuals in the synovium cartilage of individuals with both osteoarthritis as well as rheumatoid arthritis. Osteoarthritis has a huge medical impact. It is the leading cause of disability among US adults for the past 15 years. And in 2011, there were an estimated 6.7 million hospitalizations. It accounted for 10% of all ambulatory care visits in the year. The most common conventional modalities used for bone health are the pharmaceutical approaches are bisphosphonates, also calcitonin, denosumabs for osteoporosis, as well as estrogen in terms of bioidentical hormones, and as well as anabolics. The most common natural or non-pharmaceutical approaches that are used are HRT, bioidentical hormones. Also commonly used are minerals and calcium and things like calcium, magnesium, potassium to fortify the bone tissues. And commonly used are vitamin D3 and K2. Again, these help to fortify the bone tissue, but do not necessarily help to prevent the continued progression of the disease. So for joint health, the most common pharmaceutical approaches include analgesics, NSAIDs, and as we know, NSAIDs always get concerned because it does affect the stomach, and so you should consider that if somebody is regularly taking NSAIDs. DMARDs, biologics like Humira, corticosteroids, as well as others, and also there are natural non-pharmaceutical approaches. So one of the most common used supplements is glucosamine chondroitin, and actually it's one of the top ones used for all of just alternative treatment. And this has shown to help with joint health, but oftentimes it will maybe take 6 weeks for a patient to start seeing some improvement in joint health and stiffness as a result of it. The great thing about the cyplexanol is you'll often see when you're working with their patient that they will have benefits in terms of the pain within a week or so of taking the supplement. Also, there's other vitamin and herbs, and then all the lifestyle pieces in terms of physical medicine, exercise, yoga, and stretching to help relieve some of the joint pain. So how do we grow de novo bone and cartilage tissue? So to begin, we should first go through the discovery. So the discovery was found in 1965 by Dr. Marshall Urist, and he was trying to determine what it is in bones that make them regrow. And what he found when he was looking at this was he discovered an osteogenic protein complex. And what he found in this osteogenic protein complex, it activated and differentiated mesenchymal stem cells, specifically osteoblasts and chondrocytes. And then he also found that it helped to grow new bone and cartilage. And what he decided to call these were bone morphogenic protein. And this study that was discovered was produced in Science Journal in 1965 and was named the autoinduction of bone. So how do BMPs work? There are two unique mechanisms of action. So first, osteoinductive effect. So if you could see on the left-hand side of the screen, you can see the BMP protein complex is going down that pathway, and what it does is it binds to the receptors on the mesenchymal stem cells. These thereby activate SMAD1, 5, and 8 signaling. And these then translate to nucleus and act as a transcription factor, which then promotes gene expression. This gene expression helps to allow for cellular differentiation, which helps to stimulate things like osteoblasts and chondrocytes. The second unique mechanism of action is immunomodulating effect. So immunomodulating effect was towards both interleukins 1 and interleukin 6, IL-1 and IL-6, their activation pathway, and also the following downstream cascade of events or components as a result of IL-1 and IL-6. IL-1 and 6, in terms of immunology, are known as being pro-inflammatory cytokines, and they activate NF-kappa B and matrix metalloproteinase, also MMP1, MMP3, which are all pieces that do not promote osteoclastic activity. Osteoclastic, not blastic. So the inflammatory mediators, I'm going to go through that a little bit more in terms of the inflammatory pathways. So you have IL-1 and IL-6. IL-1 stimulates bone resorption, and it's key in osteoclastic activation and exasperates osteoclastogenesis by cooperating with wrinkle. So cooperates with wrinkle, and wrinkle stimulates osteoclastic activity. It also, the mediators are IL-6, which is, there's higher levels of it in the synovial fluid for circulation for an individual with rheumatoid arthritis. It also, IL-6 is part of regulating osteoclastic differentiation. So upregulates COX-2, dependent prostaglandins E2 synthesis, as well as upregulating wrinkle expression, which is responsible for enhancing osteoclastogenesis. So there are other known names for wrinkle. We have tumor necrosis factor ligand superfamily, member 11. It's also part of osteoprogenerin ligand, osteoclast differentiation factor, and TNF-related activation-induced cytokine. So it's also known as this. And wrinkle's a member of the tumor necrosis factor cytokine family. What it does is it binds to rank on cells of the myeloid lineage. So it binds to rank and functions as a key factor for osteoclast differentiation and activation. So some medication, denosumab Prolia, which is a medication, what it does, it's an antibody that targets rank on the osteoclasts and osteoclast precursors, and this thereby helps to block bone resorption. And as you could see, the BMPs also help to reduce, again, the interleukin-1 and interleukin-6 signaling, and the SMAD pathway downstream of BMP receptors. It helps to regulate the gene expression. It downregulates inflammatory mediators. And what you'll see is really rapid clinical improvement. So oftentimes when I do work with patients that are on this, they'll see that there's improvement in pain, typically within a week. Cyplexinol is also the only BMP complex orally available to address both inflammation as well as osteoinduction. And once activated, BMPs begin to downregulate both the basal and the TNF-induced expression of cytokines such as interleukin-1 and 6. The great thing about this is on each slide we do have a journal. This has been produced, there's thousands of articles produced on BMPs, and so this is a link below that actually show the use of it both clinically and also literature review on how BMPs work. So cyplexinol is not new, it's 50 years in the making. So this, again, was discovered in 1965 by Dr. Uris. And then after that, there was a discovery of the whole BMP family. For this, in terms of cyplexinol, it's BMPs 2 to 10, but there was a discovery of this full family of complements and isoforms. And then it was later used in surgical use. So BMP complex was used in orthopedic surgery for both bone and spinal healing, often used for the lower spine area, and was effectively used in over 5 million cases. And later in 2007, this was used as an oral protein complex, and it was used in the product called Ostenol. The active ingredient that's patented is the name cyplexinol. So in essence, it's really about rediscovering the discovery, because as we said, this was found in 1965, and we went from surgery to supplement. So this BMP complex also works orally for bone health, which we discussed, osteoporosis and osteopenia, and also for joint health, for osteoarthritis and rheumatoid arthritis. I often use it for many of my patients that do have the diagnosis of rheumatoid arthritis. So it is made up of a hydrolyzed collagen backbone containing BMPs 2 to 10. And then the growth factors that are included are TGF beta, IGF, BFGF, and VEGF. And the two patents for cyplexinol are specific to its protein extraction and processing process, as well as the oral osteoinductive activity. Another question that comes up frequently asked of me is, how is cyplexinol absorbed orally? So it has a really complex structure, and due to the complex structure of the protein complex, it prevents BMPs from being destroyed by the high stomach acid. And there are also receptors for the BMPs within cyplexinol. They're expressed along the entire GI tract. So you can see here 6 peer-reviewed journals below on that piece on how it's expressed within the entire GI tract, but also how it surpasses the stomach acid to be able to be utilized. So now we're going to go on to, for me, the fun part, more the clinical trials, because I think that as a provider is what really where the rubber meets the road and gives you some insight of how to use it in clinical practice. And so I'm first going to go through some randomized, it's actually a control trial, and then we'll go through some case studies. And I'm also going to share my own experience case study wise with using cyplexinol. So this one was a study done for osteoarthritis of the hip and knee. And in this study, it was a 12-week study. The number was 87. So there are 87 individuals that participated in the study, and they were aged at 55 and older. And the dose was wasn't too high. It's actually 150 milligrams I use often in the office, anywhere between 150 milligrams to 400. A lot of people commonly use a little bit higher than the 150. In the study, it was 150. And this showed their decrease in stiffness. So the placebo is to the left, it's the dark blue, and to the right is the use of cyplexinol at the 150 milligram amount. And we see in week 1, there's a 42% marked significant decrease in stiffness. And the great thing about this is it shows the increase the longer the time frame of the study. So it went from 42% in week 1 to 67% in week 6, and then continued to climb at 82% in week 12. The placebo stayed around the same. It went up to, it was 26% in that first week of study, but you could see the number was consistent from week 6 to week 12, wherein the cyplexinol continued to increase in terms of reported decrease in stiffness. The other piece, there's a significant decrease in pain. So that's why when I mention a lot of patients you do put on the cyplexinol product, you'll see that they say that there is a decrease in pain within 3 to 7 days. And the percentage for decrease in pain as compared to is actually even higher than the decrease in stiffness. So the stiffness part was already good in the slide I just showed you prior, but this one was for pain and it was even higher. So as you can see in week 1, 48%, so almost 50% in week 1 said that there was a decrease in pain, as compared to the placebo at 14%. Placebo doesn't look to have went over the 21%. It was a little higher week 6 and then went back down. But as you can see in week 6, from week 1, it almost doubled, 87% in week 6, and then continued to climb in terms of decreasing in pain to 90%. So 90% of the reported people said that there was a decrease in pain at the 12-week mark, 87% in the 6-week time frame, and 48% in just week 1. So quality of life also is a good marker to check on this, and one of the most notable is that improvement in quality of life of 90% at week 12. That was what was reported, 90%. And 36% had that improvement in just a week's time, and 75% at week 6. As you can see, the placebo as well went down as time went by, which should be expected at 7%. But you can see the people that did take the cyplexinol to the right, 90% reported a significant decrease at the 12-week mark. So now we're going to go through case studies, the osteoinductive effects of cyplexinol in the effective management of osteoporosis. This is a case study with a 59-year-old female. She was postmenopausal, osteoporotic. She also is a non-smoker and didn't have any history of these things that could affect the numbers in terms of DEXA scans and a risk for osteoporosis. So she didn't have a history of type 1 or type 2 diabetes, didn't have a history of Paget's disease, no primary hyperparathyroidism, osteo or rheumatoid arthritis, so no joint issues that were reported. And she was also not on bisphosphonate or HRT for her treatment. So in this, she was on calcium vitamin D for 53 months. And you can see the results of L2 DEXA score declined -1.3 to -3.5. So more than doubled in terms of severity during that time frame. The average DEXA score declined as well, -2 to -3.3. So in this study, you could see with the nutrients of just those two things, calcium and vitamin D, it may help to fortify the bone, but the severity of the bones actually worsened over time. Then in this study, they introduced cyplexinol at 400 milligrams for 34 months. And in that 34-month time frame, which is a shorter time frame than the calcium and vitamin D supplements, the L2 DEXA score increased to -1.8. So it started reversing. The average DEXA score increased to -1.6. So remember, before it was at -3.3 and -3.5, which we started at. So the individual had a 54% improvement with the addition of the cyplexinol. This is now a schematic showing its numbers going down over the years of that time frame, 53 months, and then showing the number increasing with the introduction of the 400 milligrams of the cyplexinol, which helped to stabilize bone mass in just a mere 8 months. So it went from -3.5 to -1.8 with that percentage increase. So additional case study, the osteoinductive effects of cyplexinol in osteoporosis. This was a 61-year-old male. He was diagnosed with polio at 5 years of age. He noticed there were issues with bone health in the 50s. He took calcium and vitamin D, and the DEXA score did decrease from -3.9 to -4.2. He was given a pretty high dose, 900 milligrams a day for cyplexinol for 4 months. So I often do that too in clinical practice, and we could talk about that in the Q&A section. There might be a loading dose depending on the severity of the osteoporosis. In this case, it was pretty severe based on the numbers, even in comparison to the prior case study. And after 4 months, they were decreased to 350 milligrams per day of cyplexinol in 20 months. So the DEXA increased from a -4.2 to a -3.3. So as you could see, it was going down initially with just the calcium and vitamin D, and then over that short period of time, the 20 months, reversing the direction. Okay, so case study 2 is a 40-year-old woman with a hysterectomy at age 19. She suffered her first fracture at 32 years of age. She did adopt a bone-healthy diet at age 32, and she also added bioidentical hormones between the ages of 48 to 50. Even with all that, her DEXA score decreased from -1.7 to -2.7 over 14 years, and she was diagnosed with osteoporosis at 53 years of age. So in this study, she was given 450 milligrams of cyplexinol. The DEXA did improve in 2 years from a -2.7 to a -2.2 in 2 years. So going down, getting worse, and it became the opposite direction from where she was actually going. And this study here is another case study 3, with a 59-year-old postmenopausal woman. She took calcium and bisphosphonate. So this is a patient that was on a Fosamax, was on a medication for years. And the DEXA declined. Not significant, but it did decline. It went from -1.0 to -1.1. And then if you look at this, when she was given 450 milligrams a day of cyplexinol, the DEXA increased from a negative 1.1 to negative 0.4. So it definitely surpassed the effectiveness of the medication pretty significantly here. You could see that big jump, that big change to almost going into a normal bone density scan. So before I go into summary, I did want to share my case example. I did have a patient that I had used the products for when I first began, and she had recently had the DEXA scan prior to seeing me. She basically had just had a little fall, quick fall, and not a really significant fall. And in that small fall, she fractured her wrist and her forearm. And she went to the doctor and found her number in terms of the DEXA scan was an osteoporosis and had no symptoms prior to that to suspect. So when she came to see me, she didn't want to be placed on medication. She wanted an alternative. But part of the worry was, okay, if I do this, I don't want to wait 1 or 2 years, 2 years rather, because usually DEXA scans are approved every 2 years. I don't want to wait 2 years to find out if this is working or not. So what we did was a 24-hour NTX telepeptide test to get a baseline, a urine test, and then we tested again 3 months and 6 months. And what she chose to do and what we talked about was having a DEXA scan in a year. So there was more out-of-pocket costs, but she did want to confirm that everything was going in the right direction. The other thing was she found during the course of taking the supplements, we put her at 400 milligrams daily. She did have a couple injuries, actually a couple significant slip and falls. She was very physically exercise-wise active, but she had a fall that she felt was more significant than the fall she had when she totally shattered her wrist and nothing happened. And so to her midway through, she's like, oh, that might be actually a good sign because there were no breaks. And so we completed the test at the 1 year mark, the DEXA scan. Her results improved by negative 0.6. So it was awesome because she went from osteoporotic just in a year to being osteopenic and actually only being off by 0.1 of having a normal bone density scan. So for only being a year, I definitely estimate with her continuing to be on the 400 milligram amount for her to be back to a normal bone density scan. The awesome thing is we're able to see it too in real life that she, had a few falls and there was no effect in terms of fractures. So in summary, cyplexinol is really a paradigm shift in molecular nutrition. It's supported by research. There's 50 years of research. There's over 15,000 medical and scientific papers on BMPs and BMP complex. It's one of the things that I love about it is that it's often hard, as you know, in the nutritional supplementation and herbal world to get research to sometimes support some of the supplementation use. So the great thing is that this includes over 15,000 medical papers. It's been used medically for 35 years. And in the last 10 years, it's been used as supplement form for chiropractors, naturopathic doctors, and other provider types, as well as patients. So it's supported by research and clinical use. This only BMPs are osteoinductive, and cyplexinol is the only orally available BMP complex. Cyplexinol provides clinical benefits in 7 days, and that's one of the things I love about it. I might give it to a patient that has significant RA or very inflamed and just injured themselves, and within 3 or 4 days, they'll say, wow, my pain is much less than before. So you will see that improvement in pain fast, and also just stiffness, which we talked about earlier in those case studies. It signals which turns on stem cells to grow de novo tissue. It helps with the downregulation of those inflammatory mediators we discussed, interleukin-1 and 6, and it also has both chondrogenic and osteogenic effects. So in terms of its availability, produced by Zycal, we have what's called Ostenol Advance, and the dosages range from 175 to 900 milligrams daily. There's also a product called Cadranol, extra strength, Prostiminol Advance K9, which is for your pets, and Gastrotine. And the global partners they are with are Alanion Pharmaceuticals and also partner with various places in the EU. And in the USA market, it's sold as Ostenol, but in private label products. And then also Designs for Health has cyplexinol within their products, but it's called tissue. The name of their product is called Tissue Regeneration Factor. So thank you so much, everyone, for participating here in this webinar. To thank you for joining us today, we're going to give you a special webinar offer. Definitely, I want to thank you all for joining me today for the webinar. I'm now open to question and answer.
Okay, I want to let everyone know that we also have Dr. James Scafidi and Dr. Jody Chaplin to hear answer to your questions. Dr. James Scafidi is CEO and president of Zycal Bioceuticals. James launched Zycal after 20 years of sales, marketing, and management experience in various healthcare businesses. James also holds a degree in biochemistry with 3 years of graduate level research in enzymology and protein purification, and has published several peer-reviewed clinical studies and trials, and is currently completing his doctorate in natural medicine. Dr. Jody Chaplin earned both a doctorate of naturopathic medicine degree and a Bachelor of Science in Nutrition degree at Bastyr University and a Bachelor of Arts degree from Vassar College. She's been guiding people to optimal health for over 20 years. Prior to her focus on natural medicine, she spent several years in the field of corporate treasury and banking. So let's go ahead and jump into the Q&A with a quick reminder that if you have any questions, to please type them in the chat window. And Dr. Scafidi, it looks like you were answering a fair amount of questions that came in as they were coming in. So we can start with the ones that have not yet been addressed. And if you have any that you thought would be useful to the crowd in general, let's go ahead and do those as well. So the first one is, where is the cyplexinol source from?
Thank you. I'll take that question, Jody. Cyplexinol is extracted from certified organic closed herd bovine femur, produced and developed right here, 100% American-made product.
Okay, the next question is, are there any adverse effects to taking it?
No. Again, as Jaquel pointed out in her presentation, BMP complexes go back to the 1960s. By one company, there's been over 5 million usages of BMP complexes in surgery. To date, it's probably about 10 to 12 million patients have received BMP complexes surgically implanted, and thousands of doctors and patients have used the oral formulation, which is cyplexinol. All of this usage to date has led us to confidently share that there were no adverse events, no side effects, perfectly safe. Cyplexinol is self-affirmed GRAS and can be used in a wide variety of bone, joint, and other health conditions.
Great. The next one will be, what about collagen 2, BioCell 2 supplements?
Yeah, that question, we saw that during the presentation. Collagen-based products have come into vogue in the last couple of years, and as we all know, collagen is a fully hydrolyzed, when it's sold commercially, is fully hydrolyzed into ditripeptides for simple absorption, providing a good amino acid source for the body. Very good for hair and nail growth. Jody probably used some of these in clinical practice. But the difference between collagen-based products, whether it's BioCell or UC2, is there are no osteoinductive signals. So no BMPs, and not able to turn on the mesenchymal stem cell, which then transforms into the osteoblast chondrocytes for de novo bone and cartilage.
Great. And Dr. Scafidi, in the interest of time, it looks like we have a lot of questions here. I want to make sure that the correct ones get addressed in the correct order. Do you want to just look through the list and read them yourselves? Would you like me to continue going through them?
Why don't you could just keep going. That's fine.
Okay.
We'll answer them. Jody or Alyssa, sure.
No problem. Okay. Do you have to take Ostenol every day to maintain levels of BMP after you don't have pain?
So if somebody is using an Ostenol brand product for joint pain, there's obviously something going awry in the body clinically. And the immunomodulating effect, we see the downregulation of the interleukin pathway, That's a pretty rapid effect. But to get to the etiology of what's caused this pain and inflammation, we want to get that joint healthy. And so that does require long-term usage of Ostenol. One can titrate up or down as needed, depending upon patient weight, condition, severity. But to get the joint healthy, the cartilage, the ligaments, that will require more than just a few days of Ostenol. But again, within the first 7 days, as Jaquel pointed out in her presentation, you're not seeing that chondrogenic activity. That is more the immunomodulating or anti-inflammatory effects.
Okay, and it looks like we have a follow-up, or at least a relevant question to that. Does the sustained benefit continued use of the product, or does the therapeutic use lead to regeneration and the DC of the product?
No, we've seen in clinical usage reported that there is a lasting effect of the proteins. However, and I think I may have responded back in 2006, the Journal of Arthritis Research Therapy published findings that several of these BMPs, specifically BMP 4 and 5, are missing in synovial fluid of patients with osteo and rheumatoid arthritis. So something's gone awry clinically in patients that have degenerative joint disease, and that's leading to a reduction in the transcription naturally of these proteins in the body and a reduction in signaling. By replacing the BMPs orally, which is what's in Ostenol, we're able to provide the body that signal to keep that joint healthy again, or bone tissue.
Okay, great. Are PTs taking cyplexinol with other interventions, such as calcium, et cetera, concurrently?
PT patients? Are patients taking it?
I would
repeat the question for us?
Yeah,
Okay.
it's written as PTS, so I would assume patients.
Yeah. Yes, patients can use Ostenol brand products, cyplexinol, concomitantly with other nutrients, calcium complexes for bone health, traditional building blocks, glucosamine, chondroitins, UC2 for joint health, and even
K2 and D3.
K2 and D3, sure. All those can be used concomitantly. And we've even had many patients call and talk to us to using Ostenol concomitantly with their drug therapy from their MD.
Great. Is there any evidence confirming the absorption of this product via the GI tract?
Yeah, I think there's, Jaquel pointed out a slide in her presentation about there are receptors in the GI lumen for BMPs. And what we know today is that the BMPs bind and exert their osteoinductive and immunomodulating effect through a receptor binding mechanism within the GI lumen. Whether a polypeptide of the BMP is cleaved and brought over via active transport or activates the lumen for de novo BMP in the body is still being researched. At the end of the day, the clinical implication is by taking cyplexinol, Ostenol orally, we're seeing these clinical effects that Jaquel shared today.
Great. And next question, is there any advantage to giving multiple doses a day over the one higher dose a day?
What we find is if somebody's going over the 475 milligram a day, which is our highest strength, and there are some rare cases or needs for that, then you may want to use multiple doses. Otherwise, generally once a day we've seen to be effective.
Great. Let's see. Can my patients call Zycal to discuss specific questions that I am not sure of how to answer?
Absolutely. Jody and I are here most days, and if we're not, certainly set up a time and appointment, and we'll consult with doctors as well, but happy to help any doctors in their practice.
That's really nice to hear. Can a patient take too much, and if so, would it result in bone spurs?
That's a great question. The short answer is no, you couldn't take too much. Just as you know, unfortunately, the body doesn't store a good protein. We tend to store other calories, which are not needed, but not the BMP. And no, additional amounts of BMP would not induce bone spurs. Bone spurs are really an outgrowth of the body's way to try to correct the destabilization in a joint and try to stabilize that. Remember when Jaquel shared back in the 80s and 90s, as we were using these complexes in surgery, we would use 400 times the oral dose directly on a bleeding bone for fusion. And so there was no aberrant bone growth or unwanted bone growth. So very safe, complex, and natural. So I wouldn't worry about bone growth at all, aberrant bone growth.
Great. We have a patient-specific question here. There's a doctor with a patient with a dislocated patella and moderate cartilage damage. The meniscus and ACL are okay, and the patient is doing well in rehab. Injury was September 14th. Is cyplexinol applicable in this case?
I would say indeed it would be applicable. The body is attempting to heal itself, and it needs the extra stem cell stimulus to do that. And so I think it would be great.
Okay, next one. What is the difference between cyplexinol and sigma anti-bonding calcium? Would you need both, or are they complementary?
I'm not familiar with the product specifically, but it sounds like you said it's a calcium-based product.
It says sigma anti-bonding calcium.
Anti-bonding calcium. Well, let's share what makes cyplexinol so unique in the natural medicine world is that it is the only complex proven since 1965 to turn on stem cells. And there are many good products sold by many companies that help augment nutrition and clinical benefits, but to turn on the stem cell, to grow the bone tissue so minerals can stick, only cyplexinol is going to be able to provide that signal. And same thing for joint and cartilage health. So there are a lot of products that we say colloquially will grow bone, such as calcium and mineral-based products or strontium, but we're really fortifying bone tissue.
That already exists.
Right. And there's a great point Jody makes. The bone tissue, it can only be fortified once it's there. As we lose the bone tissue, the minerals begin to disintegrate as well. And so that's what makes cyplexinol products different, be able to grow that new tissue.
Great. And the next question we have is, has there been any increased risk in the patient developing bone cancer noted with the use of this product?
We have seen no.
No, and let me just echo that. Prior to launching Zycal, we used to be in the orthopedic surgical business, where I've worked personally with orthopedic oncologists. And again, in the surgical grade of this protein, orthopedic surgeons would excise a bone tumor and backfill that bone void with these proteins. The binding mechanism and pathways for BMPs are specific only to the mesenchymal stem cell activation and differentiation.
Great. Let's see. Do you know if cyplexinol changes the N, and I apologize, I'm not a doctor, N teleopeptide osteomark results? I follow this marker as I can monitor it in short term rather than wait for DEXA.
Yes, we have seen that there is a consistency in improvement in those scores. However, our clinical studies are based on the DEXA.
Right.
But because they do have a little bit of a different function, and those tests are much more sensitive to other things such as time of day and diet and things like that, whereas the DEXA is firm proof.
But just to dovetail on Jody's comments, the NTX urine analysis can be used as a good early marker to look at, not as an absolute number, but as a relative change. And so doing an NTX early, then starting Ostenol, and looking 3 months later, we should see a change and some decline. And if we're not, that's an indication that perhaps a higher strength is needed. But to Jody's point, to truly confirm we're getting bone tissue growth, we want to see that on the DEXA.
Okay, can you discuss in greater detail the activation of stem cells? Local question mark?
So the question is, can we describe in detail the activation of stem cells?
Yes. I say
Sure.
they have a follow-up. They said that should have said systemic versus local stem cells.
Well, when we look at stem cells, first of all, as we all know, there's many types of stem cells in the body. When we look at mesenchymal stem cells, we're primarily focused on, in the bone tissue, those found in the periosteum, or those in the joint found in the synovial fluid. And so the mesenchymal stem cell physiologically sits and waits for the activation signal. Cyplexinol, being a BMP complex, provides that BMP signal. As the slides showed early on, BMPs exist as a heterodimer. They bind to a BMP1A and 1B receptor on the mesenchymal stem cell, which is a transmembrane complex. And so when that binding occurs, what happens in the cytoplasm of the cell is there is a phosphate group that activates a cascade of signaling called SMAD proteins. As Jaquel alluded to, the SMAD proteins bind, translocate to the nucleus, and activate the mesenchymal cell's DNA. There, more BMPs are produced. That stem cell will then begin to morph into either an osteoblast or chondrocyte, depending upon its location, and then begin to produce bone and or cartilage tissue. I hope that answers the question.
I hope so too. I understood half of it. Let's see. Any data on cyplexinol used with allografts containing MSCs or increasing native MSCs?
With allograft, are we talking about for a surgical application? Perhaps that question could be clarified.
Yeah, so the person who asked that question, if you could clarify that, we'll get back to you hopefully. Okay, next question. Oops, that's the same one. Let's see. Jaquel mentioned a loading dose. Would you elaborate on that?
Well, sure. And when we look at loading doses, we really, within natural medicine, want to be able to have a rapid response and start at a higher dose. Unlike in pharmaceuticals where there are side effects, we have to start low, titrate up to get the optimal dose. By using Osteoinduction with a loading dose, meaning for the first couple of days, if you're using, for argument's sake, the 325 milligram, may want to give the patient instructions to take 2 a day for the first 3 to 5 days if there's significant joint dysfunction, inflammation, and then titrate down to 1 a day.
Perfect. Is there a better time of day to take Osteoinduction?
No, any time, with food, without food, any time of day. It's absorbed the same.
Okay. Is there any evidence of this product increasing the speed of fracture healing in a younger patient population?
We get probably once a month, a parent will call in, their high school son has had a fracture in football or college. While we don't have clinical data, the empirical data suggests that by providing additional signaling, we should help accelerate that healing. From our surgical, again, I'll speak from my surgical experience, in fracture healing, that's where this protein started, by putting it directly on a fracture to accelerate post-traumatic healing.
Okay, and the next question, it looks relevant. Would this help regrow bone in periodontitis? Periodontitis, excuse me.
Sorry, that's yeah.
No doubt.
Sure.
You know, it's applicable to any bone anywhere that the body needs it. So yes, no doubt that it would be useful.
Okay, and is cyplexinol available as an injectable? And if not, are you planning on formulating it as an injectable at some point in the future?
Yeah, no, it's not available as an injectable. We manufacture the ingredient. We encapsulate and sell under the brand Osteoinduction capsules. We also license to Designs for Health. They sell under the brand tissue regeneration factor, TRF. This product could not be injected. You actually would then, by bypassing the alimentary canal, you would potentially run into xenogenic material, meaning not far into the body. So you would run into antigenic response. Through the gut, those antigenic natural proteins are removed.
Okay, and then how do you decide whether to start with the 900 milligrams a day versus the 450 milligrams a day?
It really depends on the condition of the patient and what the issue is. If a patient is in significant pain or really pain, the 900, that loading dose would be appropriate. If it is a situation where someone has had a DEXA without pain, not looking for a decrease in inflammation, an immediate response, the 475 dose or lower would be adequate to begin with.
Great. Do higher doses cause any adverse effects such as nausea, constipation, or other?
No. We've had people take 3, 4, 5 a day of the 475.
Okay, great. So that is the end of the questions that I have here. Everything else was either addressed or addressed individually. If we did miss any questions, we are going to provide a follow-up way that will get those to you via email. But if there's anything else you'd like to address at this point, it would be a great time. It looks like we didn't have any drop-off during the Q&A session. So great questions and great answers.
Thank you. As a thank you to all of the participants for this conference call, Jaquel will be providing 10 single-dose sample packs of our Osteonol 5X product. As we're coming into the colder weather, Osteonol Advanced 5X is a combination of cyplexinol plus 65% enriched boswellia. There are 4 capsules in a sample pack, and doctors will be able to give that to their patient. The products are labeled as a 1-hour challenge. We've seen within 1 hour, taking all 4 capsules, most people will report a clinical improvement. And products are available through both full scripts and Natural Partners directly. And Jaquel Bioceuticals would like to thank all the doctors and Natural Partners for participating in the program.
Fantastic. Dr. James Scafidi and Jody Chaplin, thank you so much for taking the time to answer these fantastic questions. It has been a pleasure talking about the principles of osteoinduction. For those of you who did not have your questions answered, we did run out of time, but as I mentioned before, we will follow up with you individually. If you have any additional questions, please feel free to contact the Natural Partners Full Script customer service team anytime. And thank you for our practitioners for joining us in this educational experience.